Okay, so we are recording. And we have a guest, Kim Underhill. Would you like to introduce yourself? Although I just did it, but introduce yourself and tell the audience what you do for a living.
Hello, everybody. My name's Kim Underhill. I'm an acupuncturist, and I used to be a teacher at an acupuncture college, and I used to help run things at the acupuncture college where I trained as well. But now I'm just an acupuncturist. I live in France at the moment, and so I'm practicing here, but I practiced in the UK for a long time before coming to live in France. And I worked in the clinic at the college where I trained in East Grinstead, which is called the International College of Oriental Medicine. It's known as ICOM, and it's one of the big colleges, one of the main colleges that teaches acupuncture in the UK, and it's the only college that teaches a particular method of acupuncture, other than one or two other places in the world. It's the only one in the UK that teaches the method that I was taught.
Okay, cool. Well, the theme that I want to carry through this podcast is basically going to be acupuncture versus modern medicine. So I do have one first question for you, which is what things does Western medicine do well, and in what areas is Western medicine lacking where acupuncture and maybe some other alternative Chinese medicinal therapies could fill the gap?
Good questions, actually. Um, I think that what Western medicine does very well is emergency medicine. And, you know, I guess speaking obviously, if you're in a car accident and you have a big injury, you're not going to come to an acupuncturist first. You're going to go and have your arm sewn back on, whatever, you know. And obviously then what might happen afterwards is that you might come and see someone like me to help you recover from that emergency. So that would be one of the first things I would say, and I would hope that's fairly obvious. I think what Western medicine has also developed to do very well is to be able to see inside the body. So with x-rays, scans, MRI, which obviously someone like myself just can't do. And, you know, in China, for example, if you go to a hospital there, and I don't know if it's every hospital, but I think all the major hospitals, you know, for example, you'd walk in the door, you would turn right for Chinese medicine and you'd turn left for Western medicine, and the Chinese medical practitioner might think that you need a scan, so he'll send you over to the other side of the hospital and you'll go and have your scan or make an appointment for that, and then you'll go back. And wouldn't that be lovely if we all worked that way? So basically I think, yes, being able to see inside the body then gives you an idea, or gives the doctor an idea of what is causing that person's problem, whether it's something simple like inflammation through to a fracture, through to a tumour, all of those things. And then what Western medicine does do very well, and when everything goes properly and it all works, is that they then deal with whatever is seen inside. If it's a fracture, they fix it, or a break, obviously. If it's something that's can be cut out, it's cut out and fixed. If there's inflammation or whatever, then they see, you know, let's say you've got a frozen shoulder, so they might then know then that that's what's causing the problem and not a tear. That's a classic example, you know, maybe a shoulder issue somebody goes for, so you have an MRI and you see whether it's just inflammation from wear and tear, or actually whether there's a torn ligament. So then that is then fixed. So I think they do that very, very well. And it's something that I think we all take for granted, you know, that these things didn't happen before, and we're very, very lucky to have that. What else might they do very well? Drugs, that's a big subject, which everybody will know. So when drugs work well, which they can do, and we all know that, we will all know somebody who has been ill, who has been given a certain drug, and it has made them feel better. And in an ideal world, boom, fantastic. The trouble with drugs is that they can be used in an experimental way with people, because often it is a bit hit or miss. There are lots of different ways of maybe trying to treat somebody with drugs, and that can take time as well, you know, while the hit and miss is happening. And whilst that's happening, maybe there are lots of side effects from those drugs, which then create other problems. So statins, for example, rather classic. So people are given statins. For people who don't know, statins are very often given for high cholesterol. And the trouble with statins is that they have quite a knock-on effect on other mechanisms in the body. And so someone like myself can sometimes see somebody where they've got the knock-on effects because they're taking a drug like statins. So that's sometimes the problem with the drug world. But equally, I would be the first to say that drugs absolutely have got their place, even though I'm trying to work with people in a drug-free way. I'm not naive enough to think that they don't have their place and they can save people's lives. It's about balance, really. And it depends what it's for as well. And unfortunately, I think the trouble with drugs is that for a lot of Western medical practitioners, they are the first go-to because it's quick. That is the quick way to treat somebody, and you know, it's a bit of a numbers game. And I think the great shame with Western medicine is that their enemy is that they don't have enough time with each patient. And so had they had the time, perhaps they might think, oh, I won't give them that drug, we'll try something else, or I might give them a drug but maybe not that one. So you then get into a cycle of perhaps the wrong prescription being given at first, and it takes time, you know, to work out what might be the right approach for each individual, because a lot of the drugs, you know, they're designed to fix XYZ problems, and we all know we don't always fall into that XYZ box. So that would be what I would say is one of the difficulties with the drug approach. Western medicine, I think, has become very mechanical, and this isn't to speak against it, but it's become quite a mechanical way of treating, a bit like, you know, if there's something wrong with your car, you go, you work out what's wrong with your car, and you get it fixed, whether it's replacing a part or whatever, you know, just the mechanic finds the problem and works out what's gone wrong. And, you know, in a much more complex way, it's not dissimilar to what a doctor is trying to do. But of course, we're much more complex creatures with layers and layers and layers of what could be illness, all in, you know, affecting each other. And that's the great difficulty for doctors, and that's probably where someone, you know, with a Chinese medicine oriental approach steps in, because we look at health in, we come at it from a different angle. Is that answering some of your things? I've gone off a little bit, probably.
No, that's fine. You can go off on tangents as much as you want. That's a fascinating answer. There's a couple of things that interest me in what you said, which is this idea that you can have this hospital that is integrated. One wing is Western and the other wing is Eastern, or at least some kind of alternative medicine.
Approach,
And
yeah.
I know that you've recently had a bad shoulder injury and you've been going through various rehab processes.
Indeed.
If there was a hospital that had one wing Western and one wing Eastern, would you be able to describe how your treatment would have gone differently? Yeah, that's a question.
Yes, I suppose going back to the beginning of it, I had a ski injury. I shattered the head of my humerus, which is the joint in the shoulder socket. So Western medicine, of course, stepped in beautifully. Thank you very much, Western medicine, and put screws and bolts in and put me back together. And the rest was left down for me to go and see the physiotherapist, which of course is still, that's a Western approach, but the two tie in together. And we're very, very lucky here in France, actually, that you get physio straight away and you get lots of treatments. So that's kind of where the Western bit stopped for an injury like mine. Now, because I'm proactive about how to look upon an injury, I then had some acupuncture. For example, one of the results after the operation was I had the most horrendous swelling in my arm, which was very, very painful, and very bad bruising, and my hand looked like a blown up marigold glove. There was just not one bit of definition of anything. And I actually hadn't realised how painful swelling can be. So with my practitioner hat, that was quite interesting actually to discover that. And I learned a lot as well by having an injury like that with my practitioner hat, to find out what it's like to have a 24/7 injury that you're trying to cope with, and the knock-on effects of everyday life and how it affects you. So I went off and had some acupuncture, and I thought about other things like my diet, and if there were things that I could take that could help reduce inflammation, for example. And then, a lot with an injury like this is just time. But for example, I spoke about, sorry, something's just come up on my screen, go away. After 6 months I had to go back. Oh, it's come up again, please go away. I had to go back and I had, this is going to really annoy me, this thing keeps coming up. Let me try that instead. I had several scans after, certain number of months, just to see what was going on, and whether the screws were okay and whatever. And it turned out that it hadn't healed properly, so I've actually just not long had another operation. So again, Western medicine, terrific. They go in, they cut you open, they chop bits off or whatever they do, they stitch you up and they tell you to go away, and you carry on with your physio. So yes, I've used the Western approach, and I've tried my best to follow my way of life, and listen to lots of people about using, making sure I do my physio and my strengthening. So that kind of answers an example for you with an injury.
Hmm. Yeah, and I suppose that speaks to the over mechanization of Western medicine, where they'll just cut you open and put more screws in or take more screws out and kind of
Yeah,
mess around a little bit before really considering maybe the damage, or maybe taking longer to consider the first time round if they're doing something right, if they're not going to
yes,
screw
it
it
was a
up later
time
on and
thing
require another
again.
surgery.
And actually, just thinking about it now, remembering back, you get loads of drugs thrown at you at the beginning. And
Mm,
only because I know my body very well, I know that there are certain drugs. Tramadol, for example, is the go-to painkiller here in France. Now, for those of people who don't know, it is a majorly powerful painkiller, and there was no consideration given to if that drug was okay for me. You know, that of course before you go in for operations they say, are you allergic to anything? Well, I'm not allergic to that drug, but my God, my body doesn't like it.
mm,
And it was only because, again, I'm aware of that and I understand my body, that because of previous operations I've also had, I was able to say, do not prescribe me that, please. I will work out how to manage my own pain with paracetamol, whatever, because tramadol makes me feel very sick and has me vomiting all over the
right.
place. And that's an example of where they didn't take the time, they didn't have the time to ask each individual, and some people might not know that it makes them feel sick if they've never had it before, but it's sort of a sledgehammer approach. Take this, take it for 2 weeks, go away and just survive. And they don't necessarily have the time to explain people if this doesn't work or if it makes you feel bad, blah blah blah. So with medication, I think sometimes they can forget that different bodies react in different ways to it. And also, you know, you're a big guy and I am tiny compared to you, both in
Mm,
height and build, and yet we'd have both been given the same dose. And
that's
that's
crazy.
always a bit of a surprise to me. Yeah,
Mm,
yeah. But you know, that's then, I guess it's just down to the individual to then go back to their doctor and say, this didn't work for me, or go into a pharmacy and then you speak to the pharmacist. So it's very hit and miss with drugs, really.
mhm. You touched briefly this phrase that I quite liked, which was layers of illness. And I
Yes,
suppose that's a terminology. I mean, you did say it is a terminology that is more relevant to alternative uh, therapies,
yeah,
rather than the
yeah,
sledgehammer approach with drugs and over
yes.
mechanization. So I suppose that's a good segue into the second major question that I'd like you to answer, which is, can you give a brief overview of the theories and mechanisms through which acupuncture actually works?
I will do my best to keep it
Yeah.
succinct. It's it's a very big subject. It's something that took me 4 years to study. It's now a 3 year degree, but when I did it, it was 4. So for people who don't know, from a training point of view, so this is kind of digressing slightly, but just, I suppose, to give people confidence in acupuncture as an alternative approach to health. People in the West are very highly trained in this subject. So it's a 3 year degree. In my case, it was 4 years, because the fourth year was essentially like an internship in a Western sense, where a lot of it was clinic based with the support of practitioners around you. So you're taught Chinese medicine, the philosophy, so I'll take you on to that in a second. You're taught about Western medicine, you're taught about everything that the points do. There are hundreds of points in the body, and at the college that I was at, I was not allowed to touch a needle for 2 years. I had to learn where all the points were, what they all did, how they interacted, their functions, and then in the 3rd year you picked up a needle. That's not the case with certain other colleges, but actually, personally, I was very glad to be taught that way, because by the time you are picking up that needle, you've got a lot of theory in your head, and you've also done a lot of observation, because you go in and you watch other practitioners. In my case, in the college I was at, in East Grinstead, you're going into the clinic and you're standing there, mouth shut, watching, and sometimes, you know, the practitioner will ask you questions. So I suppose that leads me on to when you begin, you're taught about Chinese medicine and the philosophy that informed how the medicine evolved. So the philosophy was essentially way back, if you can think 3,000, 4,000 years ago, you've got the emperor who wants to understand everything about his domain and would ask questions of his advisors and say, go and find out this, go and find out that. And the body essentially was seen in those days a bit like the workings of a city. So you've got the emperor, who is the heart, and the organs, who are the officials in the city. And you've got the waterworks of the city, so that involves the blood, the fluids, and the drainage system. So you can see where this is going. You know, you can see how they develop this way of thinking. And it's probably important, actually, just to point out the essential difference of how Western medicine evolved and Chinese medicine evolved, is that Western medicine, most people will know, you know, from stories about grave digging, is that dead bodies were cut open, peeled apart, looked at, tried to be understood. Chinese medicine evolved from watching live situations where notes were taken and they discovered, oh, there's a pattern here and there's a pattern there, and when it's hot people have this problem, and oh, when it's a very wet year people show other problems. So all of this information constantly written down, passed down through the ages. So both have got their merits, of course, but for me, watching how things evolved helped me understand how the way you're taught how to diagnose from a Chinese medical point of view is all about patterns, and these patterns evolved because, you know, they watched people with disease. So from looking at the body as a city working, they saw these patterns, and they saw that there were cycles that tended to happen, and the philosophy, you know, is about circles. So you're taught about Taoism, you know, and how this feeds this and this feeds this. And they began to see that there were patterns where if you feed one part of the body, then that helps another part of the body, and you've got this lovely circular motion that should happen. And essentially health from a Chinese, and when I say Chinese, I mean it's an Oriental approach, it's not just China, because of course this was happening in Japan, in India. They might have had slightly different names, but the philosophy was essentially fairly similar, as opposed to the rather cut and dried aspect of Western medicine and where that was going. So you had your cycles and patterns, and then of course within all these cycles and patterns they saw more cycles and patterns and more, so it gets broken down. So when you're taught, you know, a lot of it is just, it's just like being taught a different language, really. You know, it's complicated to learn, but the thing I loved about learning it is that there was a scientific approach to it. A lot of people might be a bit scathing about the Oriental approach and think that it's, you know, not scientific enough. It depends how you interpret that word, but the thing that attracted me to it is that it's very scientific and there is method. It is just a different method, that's all. And when you look at the history, in fact, you see that a lot of the conclusions that were reached from a Chinese perspective were being reached from a Western perspective. They're just coming at it from a different angle, really. So with the, what am I thinking? There's the philosophy, okay? So you learn a lot about that at the beginning. The framework, there are 2 or 3 different frameworks within acupuncture. I was very lucky to be at a college where I was taught all of them, and that's not the case. You know, most colleges, they'll focus on a particular approach. So I was taught a method called stems and branches, which is the very classical approach. If you go back into the old books, that's what is being followed. And basically stems and branches is based on watching the universe. You have to remember that when all of this was being learned and discovered, there was no electricity. People got up when it was light. People went to bed when it was dark. When it was cold, they shut down. When it was warm, they had more energy. And people very much worked within the seasons. And so stems and branches evolved from those observations. And within those observations, they also noticed with the seasons that there were rhythms as well. So, and within those rhythms and within the philosophy, most people have probably heard of yin and yang, for example. They might not understand what yin and yang actually means. But a lot of the philosophy is informed by yin and yang, and most of the medicine can be boiled down to whether something is a yin condition or a yang condition. And for example, in our very first Chinese medicine lesson, we were asked just to say what we thought things were yin and things might be yang. And so you've just got this flip side of the same coin. So light, most people would say dark, up, down, in, out, hot, cold. And so everything has got this opposite, and you learn that one means yang and one means yin. And so then that then translates into the body and parts of the body. So different parts, you've got the top part of the body, the head is seen as very yang, the feet are seen as very yin, the front of the body is seen as yin, the back of the body is seen as yang. Yin is seen as, yin is the feminine, yang is masculine, daylight is masculine, yang, nighttime is yin. And so slowly, when you start to grasp that, and it all makes sense when you start to learn it, it's not like it's difficult. You just have to, you just come out your Western box and you just put on a different hat and you start to see things slightly differently. So it doesn't take a lot to then see how certain illnesses have got a yin and yang pattern. And for myself as the practitioner, in terms of, this is answering your question about framework, we have what's called modalities. So someone would come in and say, oh, I'm always this or that. And I'll say, well, when does that happen? And someone might say, oh, it's only ever at night. So already I'm thinking, okay, this is more of a yin condition. It doesn't mean to say it's not a yang condition, because it might be there's a problem with the yang condition that's making it happen as the yin condition. So it gets a bit more complex, but just trying to keep it simple. Or I'm always very hot. When are you hot? First thing in the morning. So you then can see, okay, well, maybe that's because there's a weakness with something that makes you hot in the morning, or too cold when you should be warm during the day. So you've got this yin and yang aspect that can go on. So that's one of your frameworks. Outside of my stems and branches, we call it, it gives you a constitutional set of frameworks to work with somebody when they come, which can give you an idea about what that person should be strong with in their body and you might expect them to be weak with. So that's kind of my training. A lot of practitioners will just work with 5 elements. And again, a lot of people listening may well have heard about the 5 elements, but if not, you're basically talking about water, wood, fire, earth, and metal. And a little bit like the spokes, when you're learning it, it's like the spokes of a bicycle wheel. So what does metal or what does water mean? So with each of the 5 elements, there is a structure. And this is what I mean by, there is a framework, there is a structure, it is a scientific approach as such, it's just not Western scientific. So you learn each of these 5 elements has got correlations that are attached to water, wood, fire, earth, metal. So there's a sound for each, there's a smell for each, there's an emotion for each, and then there are lots of things lots of signs and symptoms that you gradually learn. Okay, well, that's a water thing, that's a wood thing, that's an earth thing. And with the cycles that you have and the within that 5 elements, you also have what we know as a way of treating, where you want to treat so one feeds another. So it's a nurturing cycle. We call it tonifying. There's another cycle where something is over controlling one of the meridians. Someone might have too much wood in the system, and by that you'll have seen that they're to this, which then is over controlling one of the other elements. So it's really about jigsaw pieces, and that's where your training comes in, that you start to get excuse me, these jigsaw pieces that make up a picture of that person. And probably this is a good moment to say this is where Western medicine just doesn't get a look in. because they don't have the time to spend with somebody, and because they don't come at health from an individual perspective. They don't think, their training doesn't allow them to think in this way, whereas my training allows me to be with whoever I've got time to listen to. You know, a GP, they've got 10 minutes these days if they're lucky. I've got the benefit of 45 minutes or an hour with somebody if I want to spend that long. It's up to me. Some practitioners will treat in half an hour. That's too quick for me. 45 minutes once you've had the initial first consultation. You know, that's a long time to be able to talk to somebody where they can really then, they might come in and talk about, oh, I've broken my shoulder. But in the course of that conversation, they might say, oh, I've got this. And, you know, actually for me as the practitioner, I'm doing a very quick case history, and I'm asking them about all sorts of other things in their body. And while they're talking, I'm getting these jigsaw pieces about what these strengths and weaknesses might be in that person's body, how long they've gone on for. So a thing where Western medicine is very good at treating is acute conditions. And for people who don't really understand that, that means something that's just happened, whether it's an immediate accident or, you know, you had a cold 2 weeks ago, you had COVID 3 weeks ago, and it's still not getting better. That's still seen as acute. Then it switches to chronic, and these are things that have been hanging around for a long time. And so again, COVID, very topical. We've all heard the term long COVID. So suddenly these acute conditions are becoming chronic. And something like Western medicine can struggle a little bit more because they just want to put a plaster on whatever those symptoms are. Whereas perhaps from a Chinese medicine approach, I can see that someone is suffering with long COVID more because there were underlying weaknesses there in the first place. And so actually, if I help to balance that person's body where there were weaknesses, those symptoms of long COVID start to go away, really, because their body becomes better able to deal with those symptoms. I think I've gone off track here.
No,
Frameworks.
that's great. It's fascinating answers. And it's actually a good segue because the next question is, what are some ailments that your clients come to you for, and how would Western medicine try to heal them compared to you? Kind of answered a bit of it, but I wondered if you can talk about some case studies without giving away too much information about your clients, just to talk about just some of the ailments.
I can do that easily because I can talk about the ailments generally. I think if someone's trying to understand someone like me, I'm a bit like a GP where you turn up and you tell me, you walk in the door and you tell me whatever it is. So that's the same as a GP. A GP will then either think, okay, let's deal with XYZ problem with ABC drug. Come back and see me in 2 weeks, 3 months, whatever, and we'll take it from there. If the GP knows that this is too big for a GP thing or for one kind of drug, they will refer you to a specialist, whether that's ENT, something for your guts, something for your joints, and on it goes. Whereas for me, someone will come in and they might come in with a fairly mechanical issue, like back pain, classic, or headaches, joints, gut problems. Women, of course, you've got the additional list of gynae stuff. So anything, periods alone, my goodness, they cause havoc. Menopause. So all sorts of female category ailments. Very few people will come in and say, I'm depressed, I've learned that acupuncture can help depression. But this is the beauty of time, because in the course of talking to somebody, I can surmise at times that in addition to dealing with somebody's gut problems, that they're actually suffering from anxiety, or if somebody is suffering from breathing problems, that they're actually suffering from sadness and grief. So I can start to see connections which are separate to, in their minds, to why they've come, but I can see connections because most things are connected, really. And where Western medicine doesn't have the time to dig deeper, the beauty of the way someone like myself can treat, and I really need to stress here for everybody that the type of acupuncture that you are getting in the West is very different to the approach in China, where you aren't necessarily looked at in quite such an individual way. So back to me, someone will come in to see me because they suffer from constipation. And again, it's a rare thing that someone will come in and say that, actually, but someone might have heard through a friend, oh my God, I went to see Kim, and in amongst everything else, do you know, my guts are a lot better. So someone comes in and says, I've heard that you might be able to help me because I'm really fed up. This isn't working. So in the course of actually trying to treat that condition, it might be IBS. That's a really big problem for these days. In the course of that, I've got time to try and work out and work with that person why their guts might be doing what they're doing in the first place, how long they've been suffering. Actually, is this something that's gone back to childhood? And in that particular one, yes, lots of people have had this problem with childhood and they don't know any other way, and they don't realise they don't need to be suffering with that. Or periods, women who have really painful periods. Women have just learned this thing that you've just got to get on with it and accept it hurts. Well, actually, I then discovered through learning this, it doesn't need to hurt and it shouldn't hurt. It might ache a little bit, but you don't need to be bent over double. And, sorry, I just need to get my battery charging. I forgot to plug it in. So do you see where I'm going? Someone will come in with one thing, but because I'm trying to look for jigsaw pieces, someone will come in with one thing, and because I know that one thing might be connected to maybe 5 other things, I then start to whittle down. Well, how are you with this? And how are you with that? And very often that person will go, well, funny you should say that. But actually, this isn't so great, or that isn't so great. And then slowly you build up this picture, or sometimes very quickly, depending on how well that person knows their body already. I build up a picture of what that person's strengths and weaknesses are and where the core problem might be. And then really what acupuncture is doing is just helping the body balance itself. We are an organism that in an ideal world, would be at optimum health. And it knows how to balance itself. But unfortunately, by the time we're adults, we've picked up bad habits. We do things that are not very good for this organism. And much as we might all try to be perfect, Matt, none of us are. And your body then has to deal with whatever you're doing that is not very good for your body. And again, that's the other thing to remember, is that what's good for you might be, not be good for someone else, or what's not good for you might be just fine for someone else. So this is where the individual comes in, and how strong your constitution is, your genetic inherited. A lot of people say, oh, I'm fine with my guts. My parents never had a problem. Whereas someone else will have terrible guts, and it'll turn out, oh God, yeah, my dad was awful. My mum was awful, whatever. And so actually, that's where time is useful, because I will say, does anyone else have this problem in their family? And unfortunately, this is where Western doctors they don't really have that time to do that, to pick up this great individual picture. And of course, the more people come, because you hope that somebody will come back, they'll start to feel a little bit better, which is usually what happens. Then they start to trust in you, and they'll say, do you know what, I've also got this, and they might not have mentioned that the first time round. And so they start to trust you, and then you can start to help on a deeper level. And so acupuncture's got this, this is going back to you and your layers, or me and my layers. So there are layers that go on within the body, and that's partly to do with illness and how it was discovered through looking at these patterns, that illness has depths of seriousness, I suppose. And a very obvious way of illustrating that is, if you pull a muscle, that's a very superficial problem. It's fixable, you'll get better. Yes, acupuncture can help with that. And then you'll have a cold. So a cold is another one where we've all had colds, not very nice. Some people deal with colds worse than others. Some people find it goes into their chest. So there is another layer. So you might have a cold and you get better after a few days and you don't think another thing about it, whereas somebody else gets a cold and, oh my God, it always goes to my chest, is what someone will say. So there is a weakness in that layer. That then might turn into bronchitis or pneumonia. Someone might be able to fight that off, but somebody else who's got more layers going on, that bronchitis goes to pneumonia and suddenly becomes very serious. So those are sort of layers. And then the very deepest layer of all is something like cancer, which has touched everybody's lives. No one's going to walk into me and say, I think I've got cancer. Someone might come to me and say, I am being treated for cancer, and I might be able to at least help with some of the side effects of their treatment. I am not going to say I can cure your cancer, but an acupuncturist can help with the side effects of chemotherapy, for example, and to help hold the energy so that someone doesn't completely crash until they start to get stronger after their chemo. And hopefully Western medicine has helped there and they survive whatever it is that they've been dealing with. So again, I think I've gone off on one a little bit.
No, that's brilliant.
What were we saying? Is that all right?
Well, I
One
can
thing I just wanted to
interject
explain
something.
to people.
Sure.
Oh, okay. You interject.
Okay.
Okay. I was just going to say again, for people who don't necessarily know, with acupuncture, we are working with a meridian system, and people will say, well, I don't know what that is. What is a meridian system? And a nice simple way that I like to explain is if you imagine you've got a road map, and you've got your motorways and your A roads and your B roads, and the meridian system is made up of 12 main meridians that run up and down the body, and then you've got lots of interconnecting branches, and along those main meridians you've got these hundreds of acupuncture points, and your energy is flowing up and down and through the body. And so this is just yet another framework, when you were asking me how does it work. So the working is through these meridians, where the acupuncture points are a little bit like locks on a canal. So if you imagine that the meridians are like flowing water in a canal, and the locks will open and close, and those are your acupuncture points. And the skill of an acupuncturist is to know which points to use and when, and which combinations to use to encourage that flow of movement, to improve it in the body. And you've got these internal branches, so these are your A and B roads. So this is why you can treat somebody down on the feet when they've got a problem with the head, because you've got these interconnecting things. So you won't, if someone goes and has acupuncture, sometimes they don't understand. They'll come in with headaches and they'll say, well, why aren't you treating me on my head? Because there are lots of, sometimes you'll treat locally, sometimes you'll treat away from the problem, or you do combinations. So that was just something I hadn't mentioned, in one of these, in your framework question.
Mm-hmm.
Sorry, I interrupted you. You go ahead.
Okay. So what I gathered from your answer is basically like acupuncture, or being an acupuncturist, is not really only being an acupuncturist, it's actually being a healer in general. And I suppose that's the topic of being a holistic therapist, because you're looking at the body in a holistic way. And I was just thinking as you were answering it, you also use another word which I think is probably in this context the perfect opposite word of holistic, which is acute. And Western medicine does treat things acutely. It looks at the thing on your body and says, let's fix that thing, rather than let's look at the body holistically and try and diagnose the body as a whole and fix it, so that the body can fix that one thing that's going wrong. And then you also talked about periods don't need to be painful, and I think that is a hot topic for a lot of women, and it would be good to just touch on that briefly or deeply if you can, because I think that would be really helpful for people. How you would go about treating period pain or...
Okay. Period pain for women can come far earlier than the period. It might come the day before. It might come during. Some women it'll be afterwards. And it can be very, very debilitating. So those are questions that I would ask. When does it come? When is it worse? Is it the same every month? And so slowly you find out that person's pattern. And actually most women now are fairly clear on their own problems. There are some who go, oh my God, I never know. Oh, I never know when my period's due. But now women have got apps which help a lot. I didn't have an app when I had my periods. And it might have been very helpful, because not just with the pain, but all the other stuff that goes with periods, like mood swings, feeling bloated, craving sugar, it can help. These apps sometimes can help women understand, oh yeah, this is why I'm feeling like this at the moment, and whatever. So with period pain and treating it, I then want to know about their history. Have they suffered since they started having periods as a teenager? Is it new? Some women find, for example, they've had a coil fitted, and their periods are worse. The pain is worse afterwards. Some women find it's better. Some women find that their period pains get reduce after having children. And so all of these things, are important to me in building up a picture. And pain, basically, from a Chinese perspective, is seen as a block in energy. So if you imagine you've got a sore knee, you've twisted your knee or whatever, and it hurts. It's hurting because you've got that injury and there's inflammation. But actually, if you treat in a way to create movement and get things moving in that area, then the pain should go away. So again, with periods, there's usually this block in this pelvic area. Women will often talk about how they have backache at the same time. So that's another sign that just that whole area is just a bit stuck and blocked. So I would then work on points that encourage a really good flow and try and get some movement through that area. I would work on the blood movement as well, because we talk about points that help with the movement of blood, help tonify the blood. There are other reasons, very real reasons, that women may have period pains where they've got fibroids or endometriosis. So these are things that I need, and this is why acupuncturists, they need Western medical training as well, because if someone comes with these problems and you don't know at that point, because I haven't been able to see inside, there comes a point where I need to recognise as a practitioner if the period pains aren't improving. I need to bring in my Western medical training and think, okay, why is it not getting better? Because it should be getting better. And then I will then say, I think you need to go to the doctor. You can say, I've been having treatments to try and improve my period pains, but they're still just as bad as they were, and my acupuncturists think that there might be another reason for it. And then you will be sent off and you will go and have some ultrasound or whatever and see whether you might have fibroids. So with all of these things, and I hope that's reassuring for people listening, that if you're trained well in my world, I am always thinking about, if I can't fix something, then I need to be referring you on to the Western medical approach. It doesn't mean to say you can't come back to me, and it doesn't mean to say that I can't treat at the same time and treat while you're being given medication. You can still have acupuncture while you're on medications. So that's just, a quick example of period pains. Another biggie is headaches. And so someone will say that they've had headaches. So again, I want to know, when do they come? Where are they on the head? There's 13 types of headache, for example. So Western medicine sees someone with a headache. If someone says to me, I have a headache, I'm then off on my, and this is where the training is very long, because you learn a lot about headaches, and you want to know, where is it on the head? When does it come? Is it this? Is it a sharp pain? Is it a dull pain? All of these things. And they give me the jigsaw pieces, where it is, how sharp it is, how often it is, if it's monthly. This is back to women. Very often monthly cycle, women will get headaches. So headaches are a good example of how hopefully I can really help people. Some people will come and because they have heard that acupuncture can really help, and I've helped so many people with headaches and it's terrific. But again, with the period pains, if I am getting to a stage where I'm not helping, then I am absolutely saying to somebody, I think you need to go and see the doctor, and then they will start their process of taking it further and looking inside. Your picture's just disappeared. I don't know whether that means you've disappeared. Are you still there?
No, yeah, I'm still here. Hopefully.
Okay. Okay. So long as your voice is still there. But I've lost your picture, that's all.
Yeah, I'm still here. Yeah, you've answered a question that I was going to answer later on, which was, do you ever get clients that have previously sought help with modern medical treatment, failed, and then subsequently healed by your expertise? And then the follow-up question after that was the opposite. Have you ever referred people back to modern Western medicine?
Oh, okay.
So that's interesting.
So yes, I've answered the referral bit, and the quick answer to your first one, because I know you're going to ask me something else, is most of the time in the West, the way things go at the moment is that someone like myself is seeing somebody once they've gone down the Western medical route, and for whatever reason, either they're not getting any joy, or all avenues on the Western medical route have been exhausted and the problem is still there, and they've heard from someone or read on the internet now someone like myself might be able to help. So unless somebody is very much inclined to try the holistic approach first, and there are lots of people with the bigger conditions, a lot of people have gone down the Western medical route first. Yeah.
So here's a far out question, maybe more of a spiritual question, but I think it's fitting considering your practice. Does a patient or client's openness to new treatment play a role in their healing process?
It's a good question. So I've been doing this nearly 20 years. Right back at the beginning, one of the things that really attracted me to learning about this was that it appeared to me that it didn't matter if somebody comes to see me whether they believe that this might work or not. And I would say generally that's still the case. I've got many people who come who are very skeptical when they first come, but something has brought them to me, whether it's a nagging partner or utter desperation because Western medicine isn't really helping them in one way or another, and they've come in rather skeptical. And the beauty of this way of treating is that most of the time it overcomes that skepticism for people, where they begin to feel better. For some, it's just literally this intangible sense of well-being that, you can't necessarily quantify. There are so many times where people have said, I don't know what you're doing to me, And I got to a point where actually I don't care, because I just feel better. It's very subtle, or some people say it's incredible, but I just feel better. And that I really love. I quite like it when somebody comes where they've been very uncertain to the point of, I don't think this is going to help, but I'm here anyway. And then it helps. So I'm just trying to think about your words to your question, because then it goes on. If somebody comes in where they are really into this kind of approach, you would say, does that make a difference? I don't know, actually, because I suppose my faith in the framework and the logic of what I'm trying to do, all mixed in with me and my role as a practitioner and my skill, I hope, at being able to listen and work out how to be with that person and what approach to take, and to understand, if that person has come in and doesn't want to believe that this might help, then that's just like an alchemy of then how I can work. So if somebody already comes in and has bought into the idea that this is a great way to look after my body, logic would say, well, that's just good. That's because you're already in tune with what is going on in your body. Lots and lots and lots of people are really in tune with their body, as well as lots and lots and lots of people who haven't a clue what is going on inside this thing that they are living within. And they can go through their whole lives like that and go, oh, I don't know why that happened, and I don't know why that happened. And actually you can go the other way and you can become far, far, far too obsessed why this is happening and why that is happening. And that's sort of also where I can step in. So for the people who come where they clearly don't have a clue how their toe is connected to their head, I can slowly start to inject a little bit of information there. And for people who are way too obsessed to the point where I've seen how it can make people feel ill and be ill because they are too self-obsessed with every single little tiny thing that's going on in their body, and then it becomes all a great big mishmash. So yes, it can help to be in tune, but you don't have to be in tune for this to make a difference, I think, is a simple answer.
Yeah, I like that answer. And I also like the idea that if someone isn't open to it, it's actually just another symptom that you're going to be treating. Like if
Yes.
someone's closed off, it's like, oh, okay, so how am I going to treat this? They've got a block somewhere. It's a psychological block. It might be because of past trauma or something. And you just put that into your whole picture of diagnosis. And same in the opposite way. If someone's very obsessive with their health, then it's the same deal. So that's interesting. And I suppose that's a good segue to some of the last questions that I want to ask you, which are more personal. And they are to do with belief and mental health and that kind of thing. So I wanted to ask, has your mental health benefited from working on your own vocational occupation? Does it give you a sense of meaning and purpose?
Absolutely.
And so on and that?
Definitely. Because I've been doing this for so long, I've obviously lived my life through the last 20 odd years as well, and life brings you good moments, bad moments, and lots of boring moments, and everything in between. And I have absolutely no doubt that having the knowledge that I've got now, and being much more aware of how to come at things from different angles, for me personally, and this is absolutely a personal answer because another acupuncturist might say something totally different, it has helped inform and guide me in how I have gone about dealing with my personal stuff, my life. I was also this is harking back to college, but this is for people who are listening, that I hope it would please people to know that you are taught, well, I was taught angles of how to be a practitioner as well. And so by being taught, some of that meant having to look at your own self and your positives, negatives, previous problems. Now, part of that is, so that if someone else comes to see me and they've got particular issues that might be very similar to my issues, you've got to learn as a practitioner not to project your stuff onto other people. So that's a skill that you need to learn, and that's something that gets better with time as well. But equally, what I've learned is that my personal experiences, I have learned that to be able to talk, not to offload onto my clients, but to show that I can empathise with certain conditions because I've been there. If somebody comes in, as someone did not long ago, and their husband had died, or their mother had died, or their dad had died, or whatever, well, I've gone through the deaths of both my parents, and so I'm able to say to people, I understand, and I can bring observations that I learned to help me cope with that episode in my life, and I can talk about that. Because when someone's lying there on a treatment couch, some people want to be quiet, some people like to talk, and I'm very much guided by how people might choose to be. And I'll always say to people, you don't need to talk, or if you want to chit chat, that's fine with me. And so sometimes it's in those moments that people might talk about, and that won't be the reason they've come necessarily to say. They don't walk in and say, my mum's just died, I don't know what to do. They might come in and say, I can't sleep, and I've got gut problems, and I've got headaches. And through me then asking pretty straightforward questions at that point, someone might then say, well, actually my mum died last month. And then ping, light bulb, that then just opens up a whole new world of what might be going on with that person. And so for me as a practitioner, I actually really like being older. I really like the fact that I have lived, I've brought up children, I've lived in different parts of the world, and now, because I've been treating for so long, I have listened to so many people's problems that informs me as well. Not only does it inform me as a practitioner and how to help other people, but it informs me personally as well,
Mm.
because I learn things by the way other people respond or don't respond to their stuff that they're dealing with. So hopefully
Hmm.
that helps answer that question a little bit.
Yeah, it certainly does. It's a really interesting answer. Um, Another thing that I think is important to touch on is that, um, well, it's a subject that I want to approach with my podcast in
Mm,
general, and that is um, financial security um, through a vocational occupation. I think a lot of mental health problems, if we were to look at ailments in general in a holistic way, mental health plays a huge role in people's health and happiness. Um,
indeed.
so, another personal question to you would be, does the extra financial security you have from your job give you more peace in your life?
Um, First of all, on the financial security front, this is a profession that doesn't pay a fortune.
Mm-hmm.
That's not to say that you can't survive with this profession, but you have to work a lot of hours. God, this thing keeps coming up. I just am going, I don't know if you're seeing it as well. Um,
Mm.
I'm very lucky that I've got a partner who also brings in a salary.
Mm-hmm.
So if if people are looking to go into this profession, they would need to understand. Yes, you can make a living. Of course, you can make a living, but you're not necessarily going to make a fortune unless you choose to charge people a lot of money, and unless you make people sign up for lots of treatments, which is not my way. I do not
Mm-hmm.
want to charge people a lot of money, and I wish I didn't need to charge people at all. And
Mm.
it's a sadness that this kind of treatment can't be offered on the NHS. You can get some acupuncture through the NHS, but not in the way really that I treat, or that we treat, I should say, as acupuncturists. Um, and you know, that's a great shame, because it means a whole load of people can never come and see someone like me. I'm very aware that people come and see someone like me, that they might only be able to come for a few treatments, and I try and keep the price as low as possible. The beauty of being self-employed, I suppose, is that I'm my own boss, and I can say, or I can see, if somebody only or could only pay a certain amount, it's up to me whether I then drop my charge for that person in order to make
Mm-hmm.
sure that they can come back more than twice. Because I know with what they've come for might take more than two treatments. You know, usually takes a few more treatments. It's worth remembering for people, you know, that another big difference between the Western approach and this approach, people have got very used to drugs having a very quick response, and it can cloud things, because most of the time it takes longer. You know, if you take painkillers, we all know, you know, within a couple of hours the headache
Mm.
maybe recedes a little bit, and a lot of people, that's why they just keep banging in the paracetamols, or they keep taking the Rennies for reflux, because you get a quick response and you can get on with your day.
Mm-hmm.
And a lot of people don't stop to think, maybe I shouldn't be having this at all. So the money thing is difficult, and I will always say to people, you know, I get it. You've got to pay to come and see me, and we will work this out together. If you can't come as often as I would like you to, then we'll work out a regime for you, you know, if you can only come once every 6 weeks instead of once every this or that, you know. So I try personally, I find the money thing quite difficult, and I'm able to be a little bit more flexible because I am lucky enough that I've got a partner who also brings in money that helps pay the bills as well. So the financial side, yes, it gives you, it's a good profession, and one of the reasons I decided to do it, I used to massage, and I knew way back then that I would not be massaging people when I was 80, because I wouldn't be strong enough, etc., etc. And I thought one of the many beautiful things about this profession is that I can do it as often or as little as I like, and so long as my hand isn't shaking, I can work for as long as I like, and keep treating people until I'm 80. So as a profession, you can do it for as long as you want, really, which, you know, then financially, that's good too.
So I have one final question for you. It's not really a question, but tell me one of your favorite acupuncture stories. Doesn't necessarily have to be one of your own, but preferably one that you've treated.
Oh, okay. Good question. Let me think. I have many, but it's always best to go with the one that comes into your mind first. So I had a lady come and see me. She's probably quite a good example, actually, because she's an example of somebody who had gone through the Western medical route. So we're talking headaches, and we are talking humdinger headaches, migraine, absolutely show-stopping, stay in your dark room for 3 days type of headache, vomiting, the lot. And by the time she came to me, she had been suffering for about 35 years. And she had gone down the Western medical route, of course, and had tried a gazillion and one different medications. And she did come to me saying, I don't know if you can help me. No one else has been able to help me. But I have to give this a try because I'm now in my mid-60s. Blah, blah, blah. So Kim thinks, it's quite a challenge. But on the other hand, part of me thought, okay, well, this is a big story and it's a very long story, and I am not going to get whoop-de-doo results straight away. So, you know, we spoke about the fact that this is not a quick fix because she's had this for a long, long time, and that I needed to know that she didn't expect it to be a quick fix. And luckily she did have the money to say, you know, no, if it means coming and having some regular treatments, if it makes me feel better, let's give it a try. Well, she was also an insomniac, so that didn't help things either, and that's a massive subject on its own, you know. God, sleep, people's sleep, wow, that's a you know, whole other topic. The really fantastic thing was that after, and it's a while ago, so I can't remember exactly, but she had had about maybe 5 or 6 treatments. She came once a week, and sometimes you don't have to come once a week, but with someone like her, she actually said, look, I'm prepared to come once a week and let's give it a go. And after about 4 or 5 treatments, or maybe it was 5 or 6, she went for 10 days without a headache, and she was just doing cartwheels about it. And she just was almost in tears because she said, you have no idea how incredible this is, because it means I might be able to make plans with my life.
Mm.
And I really hadn't quite understood the impact. So people who suffer from migraines, where they are just intermittent, there's no pattern, they can be so debilitating that you end up curled up in a ball in a dark room. For people like that to live like that, it's very tiring, it's very wearing. And it was just the most fantastic thing to see her gradually improve and start to believe that there was a different way of life waiting for her. And it was very, very exciting for me. And probably the longest she managed to go without any kind of headache was 6 weeks.
Wow.
So that meant she could go away on holiday and not worry that half the holiday was going to be ruined. And actually, you know, when she came back, she said, "Oh God, I had a headache." When we then broke it down, it wasn't that they had just decided to come back. There was a reason that she had a headache, because she hadn't drunk enough water for a while, and she was going through a massively stressful time because of family stuff. And I could see pretty quickly, as she could, that she had a headache, because actually probably most people would have had a headache with what she had gone through in that week. And so she's probably one of my, you know, she's the one who came into my head. And, you know, the lovely thing in all of that is that we became very close as well. Not, you know, not becoming personal friends, but, you know, you develop a relationship, because that trust that comes from somebody, and in her case, oh my God, after 35 years, someone has managed to break through this god-awful thing that I'm trying to cope with. And so the joy that then comes from that person, it then is lovely for me as a practitioner to experience something like that, and it was fantastic.
What a wonderful story. I think that's a great place to finish. What we can do now, though, is maybe you can just give the audience some information about how to find you, or contact you, or maybe go to your website in some way.
Well, as I said at the beginning, I'm living in France, so unless you're listening to this and you're around the corner, you're probably not going to be able to come and see me. But what I can say to people is their best bet is to go to the website for the British Acupuncture Council. Now, not everybody is a member of the British Acupuncture Council, but most people, most practitioners are. Not everybody who qualifies. And the British Acupuncture Council is a very, very good place to start if you are looking for a practitioner in your area. And I think it's called, it's www.acupuncture.org, O-R-G. And for a start, there's a lot of information for people to go to. There are lots of links, but they have a postcode finder on the first page, and what you can do is put your postcode in, and you'll then get a whole load of because there's a directory basically of all practitioners, both alphabetical and in areas in the UK and overseas. I'm now an overseas member, so my name would be there with my contact details. But basically, you'll see wherever you're living, anything from 1 practitioner to 30 practitioners come up in your area. You can then click on to you'll see what someone's address is. You might find that there's someone 5 minutes around the corner that you never knew about because they work in from their own home, and you can look at their website. And anyway, I would say to people, look at 2 or 3 websites to see whether someone resonates. You know, you might read about somebody and you think, oh yeah, I like the sound of them, or that doesn't work so well for me, or actually I don't think I can get there after work, or I could get there in my lunchtime. So it's that kind of thing. That's the best thing I would suggest, is to go and have a look. You can then contact that practitioner, and if you know, think information on their website doesn't answer, but most practitioners are like me, they will deal with all and everything. There are a few people who specialise, where they might specialise in fertility, or they might specialise in working with children, but most people really just work with all and everything. And you can contact them and you can send them an email and say, I've got XYZ, can you help someone like me? And, you know, see where it takes you. And very often the person that you find, you kind of find them because they're right for you. Not always. Or you might go to somebody and then just think, it's not right for me. So don't be deterred by that. You'll find somebody else where actually they're just better suited for you as a personality. So that would be my advice.
That's really good advice, and thanks a lot for giving it. Well, this has been really, really interesting just from a personal point of view, because I've learned a lot about acupuncture that I didn't know. And then the answers to your questions were also really fascinating. So, yeah, I just want to thank you for coming on and doing this and talking. I thought it was really great.
Good. Well, it's been my pleasure. I'm sure there's lots of things I haven't told you. There's one thing I just want to tell everybody. Can I tell you just very quickly?
Yeah.
As far as the topic of Chinese medicine, because I was going to say this at the beginning and I've totally forgotten. Acupuncture, so Chinese medicine is like an umbrella term. Acupuncture is one bit of Chinese medicine. You have herbal medicine, you have nutrition, you have exercise and meditation. So acupuncture is one approach. The herbal side, very important. I really want to say to everybody, animal products, there will be no herbal medicine practiced in the West where there are animal products. Is not allowed. So there is, you can go down the herbal approach with confidence, and that's all I'll say on that subject. The nutritional side is another big side. It's not nutrition from a Western aspect, it's called food energetics, and again, it's back to these modalities I was speaking about, where does something make you feel better, or do you get hot, do you get cold, does it create damp? So the Chinese found that different foods create heat in the body or improve moisture in the body, and so that ties in with your diagnosis. So basically nutrition is another part. And then exercise, you're talking about Qigong and Tai Chi. And so these are muscle strengthening and breathing exercises. So acupuncture is one bit. And I just suddenly thought it was quite important actually just to add that bit, because people might not know that.
Yeah, and we'll have to do another podcast and we can go into more details about those things if you like.
Okay, I'd love to.
Yeah, sometime in the future, maybe. So yeah, we can end there.
Well, good luck with this, and thank you for having me.
Yeah, thank you for coming on. It's been great.
Okay, and I'll see you soon.
Thanks. Okay, bye.